Good evening, everybody, and welcome to the webinar. It is November, not the 22nd, actually, it's November 2nd, 2015. Tonight's webinar might be one of the more fundamental webinars in our library because trauma is now as we understand it, as we think about it, it really is at the core of most of the issues that our clients are dealing with, whether it be a big T trauma or a small T trauma. And I'll talk about that as we go along. That part of what we try to do is unpack the symptoms, get beneath the symptoms, look past the behavior, let the behavior lead us to a place where we can get at the root of what the issue is, which is some kind of wound, some kind of trauma. In fact, this kind of thought has been in mental health for years and years and years. The earliest studies or observations about talk therapy were able to understand that when people could begin to talk about their wounds, begin to talk about their trauma, that their symptoms started to disappear. That was the discovery of modern therapy. So with that, I'm going to talk about trauma, define it, talk about post-traumatic stress disorder, talk about ways that we can treat it, and hopefully, I think this is so important as a parent, give you some tools and insight to be able to respond to your children in the most optimal way. Defining trauma. It's an event or an experience that overwhelms a person's ability to cope or integrate the ideas and emotions involved with that experience, with potential repetitive responses of isolation, hypervigilance, and self-destructive behaviors as adaptive coping. That's a mouthful. So it's just something that overwhelms us. Something, I heard somebody describe it one time as anything less than ideal. And of course, the greater the magnitude, the farther away it is from ideal, the more jarring it can be, the more difficult it can be to cope with and deal with. So again, if we stop thinking about this black and white kind of dichotomy that there is trauma or isn't trauma, and we begin to understand that the way that human beings process events in their life that are stressful, and we're all going to be overwhelmed at a different level, we can begin to understand where our mental health symptoms come from, where our diagnoses come from, where our poor coping and symptoms and behaviors come from. Very, very critical to the idea of trauma is that a person's sense of safety is threatened, right? And it doesn't take much sometimes for that sense of safety to be threatened, right? We have to have this feeling. Along with that is this idea about being out of control, right? When trauma occurs to us, we're not managing or controlling that event. It is happening to us. I like this quote. It is a quote that they share in Al-Anon or Codependence Anonymous often, which is, if it's hysterical, it's historical. So when you find yourself reacting to things, reacting to triggers, to events, to relationships, in a way that at some point you begin to recognize this is an inordinate response to this particular situation, what you know is that there's some trauma there. So our trauma gets exposed when we're not able to respond. And that means when we get really reactive, when we get really frozen, when we get symptomatic, when we have a really overwhelming feeling or reaction, that's a trauma response. And we can see that in our children a lot of the time. We see them reacting to situations, and so what's happening for them is they built up this trauma response, and they're acting like it's life or death, like it requires fight or flight. What defines the magnitude of trauma is intensity, how severe it is, and that kind of makes sense. That's kind of common sense. The duration of it, the longer, of course, that it goes on, the more chronic it is, the more difficult it can be, more overwhelming it can be. What stage of life it occurs to us at, right? The earlier stages are the most sensitive and critical stages, and it's not easy to repair those, right? Those are more difficult to repair. But something that happens with us later in life when we've developed more resources, more defenses for that matter, that's going to be more difficult to deal with. How invasive it is, how much we experience a loss of control, how much the event threatens our literal safety can have an impact on the magnitude. How much shame there is associated with it, right? There's not as much shame as getting in a car accident, although that can be very traumatizing. Whereas with sexual abuse, there's a lot of shame in our culture around sexual issues. So that's going to have an impact on how somebody unpacks it, deals with it, heals from it. And then, of course, there are resiliency factors. That's probably one of the most fascinating aspects of trauma research and trauma study lately is what creates resiliency? What is the thing that in somebody that causes one person to react to a situation with a lot of symptoms and one person to seemingly take it in stride. And of course, everywhere in between. Post-traumatic stress disorder, we've all heard of this before. We hear it oftentimes associated with veterans of war. PTSD is, in part, the tortured conscience of good people who did their best under conditions that would dehumanize anybody. That's a fancy poetic way to say that it's normal given the situation you went through. And that's why no matter what the symptom, parent, child, adult, my ideal response when they come to me and they have whatever the symptom, however off-putting or crazy the symptom seems to be, my ideal response would be, you must have a good reason for that. I assume you do. And then oftentimes when we have the discussion, and sometimes that discussion takes, in wilderness therapy, it can be accelerated, and in some therapies it can be accelerated, but sometimes that conversation with clients takes weeks, months, and even years where they feel safe to share it. And when we can begin to talk about it, we can begin to understand why the symptom is there. They can experience compassion. And through that compassion, they can then develop the courage to be able to deal with, heal, sort out, emotionally express the original wound. So in PTSD, post-traumatic stress disorder, there's exposure to a traumatic event. And what happens that defines it as this disorder is that the person continually experiences or re-experiences the trauma. It's like it's undigested, and so it keeps coming back up. There's oftentimes associated with PTSD a persistent avoidance and emotional numbing. We're going to talk about the relationship between trauma and addiction tonight. And that's just another way of saying when I'm trying to numb myself, trying not to feel, what is the relationship between my trauma and that behavior, that attempt? The symptoms, the persistent symptoms of increased arousal, not present before. So, for example, classic example is a car backfires. And a person that struggles with post-traumatic stress disorder from war, let's say, is going to hit the ground, right? But more subtly, parents that have certain elements in their own background are oftentimes going to relate to their children from a trauma response. If you had an alcoholic family, if you experienced betrayal in your life, if you had a brother that committed suicide, right? Those are obvious examples, and there are many more of when you see your child starting to struggle, you're going to respond to those struggles as if they were that original undigested, unresolved trauma. And so your response could be disproportionate to your child's behavior. And similarly, when parents experience traumatic events in the context of their children, their behaviors and their choices, that can then lead to a parent's later on disproportionate response to it. So the children can be the source of trauma. I think one of the most under-discussed ideas is how children can create trauma in parents' lives. And I think there are a lot of things that a lot of our parents have experienced from their children that would qualify, maybe even as big T trauma. The duration of the symptoms has to be consistent. So all of us, in the wake of something difficult, can have a trauma response. But if that seems to persist, then we're stuck in this disorder. And of course, there begins to be impairment in life. Response flexibility diminishes. Rigidity in how we respond seems to become crystallized in these kinds of events, this kind of disorder. With regard to specifically sexual trauma, the thing to talk about, to think about, is that they're not alone. Sexual trauma, sexual abuse, is much more common than many people think. The numbers are between 1 in 3, sometimes people say even 1 in 2, to 1 in 5 females has experienced some sort of sexual abuse. For males, it's somewhere between 1 in 3, 1 in 4, to 1 in 7. But still, you're talking about somewhere around 25 to 15% of everybody. So that means if I walk into a group of 10 students, 2 or 3 of them will have experienced sexual abuse or sexual trauma. That's pretty significant. And generationally, I think we're actually improving. There's an old idea that the history of women and children is a nightmare from which we are only beginning to awake. So now with our awareness, with our education, with our resources we have, we're much more sensitive to these kinds of trauma. It's important for them to understand that their innocence was stolen, even if they gave it up without a physical fight. Oftentimes, they were seeking for attention, somebody with more power, somebody that was in a position to be there for them, took advantage of them. And a lot of them have guilt around that. Like, I should have fought, I should have done something more. And of course, the message is you were the child. It was not your responsibility. Yes, you wanted attention, but you didn't want or need that kind of attention. It's important to normalize the sexual dysfunctions that come or are associated with sexual trauma so that people don't understand that don't believe that they're broken or crazy. It's important for all of us to contain their reaction. Containment, again, is that analytic, that therapeutic principle of, can I respond in an ideal way? Can I respond without a lot of fear, without a lot of anxiety, without a lot of rage, without a lot of shame? And because the victim, if sharing sexual trauma, for example, sees all of those reactions, even though they might have their origin in love, right? Anxiety, for example, from a parent who finds out from their child they've been abused. Even if that originates from a place of love, the anxiety is interpreted by the victim as something's wrong or unappealing about me. And then, of course, getting support in a group format from others can be a very healing part of the process. So let's talk about big T and little t. This is something we talk about in therapy all the time. Big T are the usual suspects, right? Sexual abuse, death of a loved one, being at war, getting raped. Those kinds of things are pretty obvious, right? Maybe even divorce of parents could be big T trauma. Being abandoned by one parent or both. Those are big T traumas. But little T traumas, and it's a lot of gray. Little T traumas are anything that is less than ideal, where we are hurt, where we felt unsafe and out of control. And this is the most important thing about trauma. Maybe one of the most important things about parenting is you don't get to decide. You don't get to define what somebody else thinks is traumatic to them, what somebody else thinks is hurtful to them. They get to decide it. So your version of their childhood, that it was a happy childhood, that they should feel grateful, that they should feel gratitude, you don't get to decide that. They get to feel whatever they want to feel, whatever they feel. Let's talk about resiliency factors, because again, I think that's a really important part of this. The structure, the safety, the consistency of the family of origin is a huge contribution to resiliency. If it's stable, if it's not reactive, if the rules make sense, right? If that's the context in which trauma occurs, it's much more likely that the child is able to adjust to it, to heal through it, to heal from it, to move through it. The more chaotic, the more there is a disparity between the overt rules and the underlying messages. The more the processes are chaotic, the more even things like the schedule are chaotic. The more extreme those are, the less safe the child feels, and the more likely that trauma at any level is going to disrupt healthy development. The ability for the family to process emotions, to make it safe to feel emotions, and most specifically, to experience their emotions and to experience validation, that they're not crazy or wrong or bad for feeling them. See, the rule in healthy families is everybody gets to feel whatever they get to feel. That doesn't mean that boundaries need to be compromised, but everybody gets to feel. And that applies to you folks. You get to feel. You don't have to be right. You just get to feel. And so the damage occurs when our children's feelings or emotions scare us, cause us anxiety, overwhelm us, upset us, disgust us, frustrate us. All of those kinds of responses in our families as parents create a less than safe, a less than nurturing environment. And to the extent that we can provide that, we increase resiliency. In my dissertation, I've shared this many times, in my dissertation of all the things we studied a lot of measures. The number one thing that created resiliency in the face of trauma was if one stable, consistent adult found the child, knew the child, saw the child, could be there for the child. And then the traumas that we studied were less likely to create problems in young adulthood. And that's what I call anchor relationships, right? Healthy attachment. It doesn't have to be a mom or a dad. It can be somebody else. It can be a teacher. It can be an uncle or an aunt. Sometimes an older sibling. But somebody that's calm, that's stable, that's grounded, that's there for the child, that experiences the child as the bee's knees, right? as the most wonderful thing. And when the child is upset or distraught, anxious, sad, frustrated, the adult in this case can handle it, can be calm, can be nurturing, can be validating, can be connected, can see the child. That is the greatest contribution we can make to our children's resiliency. That's why the first skill we teach you is the I feel statement and reflective listening. That's why I talk about containment. That's why the letter writing is so important, and the coaching that goes along with it is so important. How does the support system respond to the trauma? Do they get anxious? Do they not talk about it? Right? Is there a adequate support system in place for the individual, whether they be adult or child? What kind of resources do they have internally and externally to the support system? Those are all going to have an impact on resiliency. And then, of course, multiple traumas, either chronic or various traumas, are, of course, going to have a more significant negative impact. Let's talk about trauma, the brain, and addiction. Trauma or stress causes the brain to produce neurochemicals, cortisol, and endorphins, regulated by the hypothalamus. Exposure to trauma can lead to individuals' use of chemicals or other risky behaviors to replicate the chemical reaction, and so that the person can experience a sense of well-being, right? I can almost become addicted to trauma. Or I can ingest chemicals to give me that sense of well-being that happens after a trauma. And the body can do that for us, but if we find that not enough, we can be drawn to that. This is why addicts or family members in an addicted family are often drawn to drama, intensity, stress, and fear. They cause the brain to generate cortisol and endorphins. Circumstances and a lack of control over during the episode, a feeling of one cannot stop. Oh, that's actually it shouldn't be on there. That's a mistake from another webinar. I apologize. So trauma predisposes us oftentimes to want to ingest chemicals to give us that sense of well-being. Right? We're drawn to that calmness, that the endorphins that our brain can naturally produce, but sometimes not enough. And so we're drawn to that. And then the deviousness of it is the more we ingest chemicals, the more we engage in high-risk behaviors, the less that our body is going to produce those chemicals during a state of peacefulness, during a state of relaxation, during a normal state. And so we'll need to take more and more chemicals to feel okay. The brain stores memories, events, in clusters called cell assemblies as interconnected and associated events. So it's not like one spot. It's like my sense of smell, my ability to hear, my verbal as I become an adult. All of those areas are connected in one memory, right? So they're all interconnected. That's why you can smell something or hear a song and it brings back a memory, because they're connected, interconnected in that way. Because of the way in which memories are triggered by association, an experience, odor, texture, sound, or object reminiscent of any part of a memory stored in the cells of the brain can stimulate associated memories. Also, because memories with a high emotional content, pleasant or unpleasant, are more easily recalled by the brain, traumatic memories have a sort of hierarchical power over the less emotionally laden ones. We take in information through all the five senses. Many traumas are pre-verbal. So that's why we talk about early childhood a lot of the times, because these traumas are not necessarily stored in the rational part of our brain, the verbal part of our brain. We don't have any association with the memory there. It is difficult to reach these wordless places and reflect upon them exclusively through the use of language. But when our bodies are engaged, we can move through the memory and show what happened rather than trying to reconstruct it through our words. That is why we do wilderness therapy. That is why we do psychodrama. That is why we do initiatives and therapeutic games. Because we're trying to access the trauma, the pain, through all the five senses, not just through talk therapy. Talk therapy can be wonderful. Talk therapy is an anchor. It's a pillar of our therapy. But we want to expose our clients to all those things because they're less capable of containing it. They're more apt to access the pain, the trauma, the difficulty when we engage all the five senses. Even being in wilderness can bring up and remind people of their trauma, can expose it for the first time. What are the effects? It depends upon the age, right? These are the various stages that an adult goes through as we understand it. They start off with a place of trust, and they start in their twos to decide what they can and can't do. Then they develop the ability to make things, to make a difference. In adolescence, it's about autonomy. And then later on, excuse me, pre-adolescence is about autonomy, and then it's about identity and adolescence, and then intimacy in young adulthood. So depending upon what stage or what was blocked by the exposure or the trauma is going to have a different impact on the child. And also sometimes these kinds of different kinds of trauma carry with them a different message. It can threaten your sense of autonomy. Betrayal in a relationship affects us in our ability to create intimacy. Unpredicted, unprepared for, unplanned, out of ordinary, damaging trauma can affect our ability to trust the world. The world is not a safe place, right? That's what happens in war. Is anybody, anything can get you anywhere. So that basic core developmental phase of trust, even if it occurs in adulthood, can be triggered, can be destroyed, can be injured. In PTSD, of course, there's this overwhelming fear. The world is not safe, a sense of powerlessness, helplessness that I can't make a difference. And it is near the point of delusional horror for the individual who suffers from it. And some of us can relate to some of this, right? That's what's amazing or even frightening about all of this, is some of us can relate to it. Oftentimes, the effects of trauma are dissociative symptoms, wanting to numb, wanting to not feel, to get away. Cutting is a dissociative symptom, right? I'm going to focus on the physical pain so I don't have to feel the emotional pain. Food can be an issue. Of course, substance abuse can be an issue. Far out crazy behavior. The more far out the behavior, the more likely, the more confident we are that it's tied to some specific triggers, some specific trauma. Again, an ability to attach, to make healthy relationships, difficulty forming intimacy. Angry oppositional power struggling can be a child wanting to take back or an adult wanting to take back control. Sometimes the best way to understand how somebody feels is, how do you feel when they act out on you? Think about that. Think about your children and the ways that they're acting out, and how do you feel? Many, many times, that's how they feel. And they want us to feel how they feel. So that's sometimes what the oppositionality comes, it tries to create in us the feeling that the child is feeling, which is small, powerless, scared, vulnerable. Identity disorders, right? Don't know who I am. Don't know where I fit in. Sometimes the person who has experienced trauma at the hands of another can begin to identify with the perpetrator. And again, it creates that experience where I want other people. That's what projective identification means. I want other people to feel what I'm feeling. I want to give them my feeling. And I'm going to do that by identifying with the perpetrator. Lying, exaggerations. The amazing thing is that the things that people develop to deal with trauma are often very off-putting. They're often the people who need the most loving and healing attention are the ones sometimes who are the most difficult to give it to. That's the irony of all this. That's why it takes so much work on our part as parents, as family members, and as therapists for that matter, to learn to see past it, to learn to not make it personal, not be injured by it, not subject ourselves to abuse, but to actually not absorb it at all. For parents, reading can be helpful. We have, if you go to the Parent Alumni Foundation page, and the link is in the webinar every week, there are different subjects, and one of them is trauma. And you can read about trauma, learn about it, become educated. Going to therapy is important for parents. Parents, I had a parent say today that when they first went to therapy with their addicted daughter, and it wasn't just addiction, she had all kinds of mood issues, cutting, really a mess. They said, this is not our problem. And they were resentful of the idea that, why do I need treatment? Of course, after a couple of months, they realized that they were involved in a dance. They were complicit in ways that they didn't understand, that it wasn't about cause or blame, but it was about a way of interacting that helped to maintain the symptomology and got in the way of healing the symptomology or looking at what was underneath it. Going to support groups and peers can be important, oftentimes less threatening than us judgmental, ignorant professionals. Understand the understandable. It becomes your job to understand. When parents say, I don't understand it, my response is, well, then try harder. That's your job. And the first place to go to when trying to understand your child is They're doing it because it works. They're doing it because it helps them not to feel pain. So we'll just start with that assumption and then we'll try to unpack it. But our messages about I don't understand you are oftentimes us trying to shame the child and saying, you're crazy. This is unreasonable. I can't believe you're doing this. I think one of the things that's changed in my career, and I don't think it's just me, but I think it's in the field of wilderness therapy specifically, is that we are much better at treating the underlying issue now than we were 20 years ago. We're much less likely to pay attention to the symptoms, although that can become tempting because they draw so much attention, which is part of their function, is to draw attention away from the child and the hurt. And it's important when you're treating somebody, this is important for parents to know, it's important when you're treating somebody who's had trauma that you're going to take it slow. We can't just invasively inject ourselves into them, right? If you do that in some ways, you're recreating trauma. Somebody who fundamentally was exposed to trauma, and part of that being that they lost control, has to be given some of that back. And so it's important for you to know something about your child, but we don't always tell it to them. We're going to gently invite it out. We're going to create safety. We're going to be quiet enough with them that they feel safe enough to come out. And it can't be about our anxiety and on our time frame. For the child, that's why we want to empower them. Validation, listening, and understanding becomes the nest, becomes the bed on which everything lays. We're going to focus on the relationship. How they're responding to us is going to inform us. How we feel in reaction to them is going to inform us about what's going on for them. We're going to, of course, address cognitive distortions, but not from a place, again, of shame and of control and of it's inconvenient for me, but from a place of love and compassion. We're going to try to de-shame, or excuse me, I skipped one. Client-driven. With trauma, it's more, the more severe the trauma, the more patient we're going to be with the unfolding of the process, because we don't want to recreate that experience of a lack of control. Do this for me. Do this to make me feel better. Do this so I find some relief. Isn't that, in essence, the core of abuse sometimes? Is that the adult or the one with more power is being served? Their anxiety, their discomfort is being lessened, and the child is serving that function, so we don't want to recreate that. De-shaming it is important. That's why, as a therapist, this is not we're not priests or rabbis, right? We're something entirely different. We don't have a need for this to be a moral issue. It can be a medical issue, a trauma issue. The brain is affected by trauma. The brain changes its shape. It changes its ability to function. Old pathways don't work. Because the core sense is a feeling of lack of safety, the child is much more likely to respond from the lower parts of the brain, the more primitive fight and flight parts of the brain. And so that's why the behavior is going to be nonsensical, but not shameful. With trauma, the more trauma, we're going to be strength-based, focusing on paying attention to where their resources are, understanding that this was their best way of coping, that it makes sense that they did this given the circumstances they found themselves in. Understanding the function of the symptom is, in some ways, what I've been talking about all night. And then creating a reparative emotional experience, first with the therapist, and then with the group, and then with mom and dad and parents and family at home. And that reparative experience is grace. That reparative experience is we love you. That reparative experience is, yes, you have an issue, but we're going to look at ourselves. We're all going to be a part of the solution. And it's not all on you. And that kind of experience can be incredibly healing. Part of what we're going to do is we're going to talk about, write about trauma-related memories and feelings. We're going to try to get rid of, give a place for that fight or flight energy that comes up. That's why being physical can be helpful, right? Escalating anger needs a place to go. An anger that escalates, that's disproportionate, is evidence of a person's trauma response. Learning how to regulate one's own emotions. Building and rebuilding the ability to trust other people, starting off small. That's why wellness therapy is so powerful, because you're in a group of 6 to 8 to 9 peers, 4 staff, who stay there for 8 days in a row. And that world is manageable. Out in the regular school, the typical workplace, there are so many variables that we don't have control over. So starting off in this, what I always say is a small box, can be really helpful. And then not focusing on behavior or symptoms. Somatic experience is one aspect of treatment. Experiencing takes advantage of the body's unique ability to heal itself. The focus of therapy is on bodily sensations rather than thoughts and memories about the traumatic event. By concentrating on what's happening in your body, you gradually get in touch with trauma-related energy and tension. From there, your natural survival instincts take over. So we know that our neurology is not just in our head, it's all throughout our body. And a lot of the more recent research around trauma is that people can learn to feel their trauma in different places, right? And because it's not a verbal storage, we can store it in all of our body. That's why we end up with pains and aches sometimes. That's why we end up with ulcers. That's why we end up with back and neck pain. Some of that is physical, but there's a connection between the mind and the body and this entire thing. And so learning how to feel, learning how to breathe, participating in experiential therapy like Evoke can be helpful. EMDR is also another way. It incorporates elements of cognitive behavioral therapy with eye movements or other forms of rhythmic left-right stimulation. These back and forth eye movements are thought to work by unfreezing traumatic memory. So we're almost going into the code, right? It's not rational, it's not talking, it's not coming out, but we're trying to access a part of the brain through EMDR. And that can be a powerful way to access, treat, and release trauma. Cognitive behavioral therapies help you process and evaluate your thoughts and feelings about trauma. While cognitive behavioral therapy doesn't treat the physiological effects of trauma, it can be helpful when using additional body-based therapy such as somatic experience or EMDR. So we're going to use experiential therapy, right? We're going to do that at Evoke. And we're also going to challenge people's thought distortions, people's beliefs about the world. We're going to do that patiently and gently, but we're going to do that in addition. For you, for them, reading gives education about trauma and symptoms, normalizes it for the family and for the victim. It creates community. It's not you against the world. There's hundreds of thousands, millions of people who have experienced similar things as you. And even reading gets you connected to that community. It challenges the excuses to make a mess of their life, right? That's a fantastic phrase, isn't it? It identifies feelings that only victims would know about. It creates a roadmap for the past and what's going on today and where we're headed in the future. So it can really frame the entire experience. Alice Miller said, when we then realize that all of our lives we have feared and struggled to ward off something that really cannot happen any longer. It has already happened at the very beginning of our lives when we are completely dependent. It's this idea, and she's talking about child development in general, but it's this idea that we're trying to prevent something from happening that's already happened. And if we can go back to it, whether it was something that happened like getting bullied in school, being made fun of, the teacher embarrassing us, our father yelling at us, our parents getting divorced, right? No matter what it is, when we can go back to that and sort it out, we don't have to continue to be hyper-vigilant to ward it off. And that's an important way of understanding. We do here and now stuff, absolutely, but we also do historical stuff. And when I hear people say we don't go back in history, my thought is, that doesn't even make any sense. There's so much in our history that can inform us about what's going on, how we're responding today. And both deserve attention. And like a lot of things in life and in therapy, it's important for us to be able to hold on to that dialectical idea that it's not either or in this process. Remember that powerless feelings are at the core. It's important that we allow them and give them some lead in this to heal in their way, not in some predetermined way by us. When I say respect the defenses tell us as much about the child as anything can at times, or for the parents. It tells us about their context. It tells us about their trauma. So we're not just going to come in and hit their defenses right in the nose. We're going to respect it. We're going to understand it. We're going to make sense out of it. We're going to then gently ask and invite them to consider the pain that led to the building of that defense. And we can't force forgiveness. We can't force healing. Even though we want it, even though it might seem that it comes from a place of love, we can't force it. Be careful to push for in contrast, that we go to all of the feelings. That's where we don't let the symptoms lead us astray. We don't get so tied to the symptoms. It's important that we learn to feel grief, anger, betrayal, hurt, sadness, all the emotions that we have, and that they be safe, that they be welcomed in our lives as parents. The last thing I want to say about trauma is this. I have so many parents who want to find the one big fish, right? Was it the divorce? Was it the adoption? Was it the abuse? Was it the bullying? Was it the learning disorder that caused social anxiety? What was it? And my response is this. I'm a pretty good fisherman in terms of psychology and child development. I can begin to see and to look and to find them. But we have to teach your children how to fish. Like the old adage says, give them a fish and feed them for a day. Teach them how to fish and feed them for a lifetime. It is your child's job to learn how to fish because for most of them, many of them, the worst, most painful things in life haven't happened. They're going to happen tomorrow or the next day or years from now. And many of you know that. So we're going to teach your children how to fish. Yes, we'll look at the usual suspects. We'll talk about the divorce. We'll talk about yelling. We'll talk about being bullied. We'll talk about all that stuff. But more important and core to that is the way that the child has organized themselves around their pain with their symptoms. And how has that pattern led to what we call a diagnosis? And how can we teach them a different way of participating in relationship to emotions? How can we teach them, model for them, encourage them to come away from those symptoms which protect them from hurting into a richer, more full life? That is an amazing thing to ask a child to do, let alone an adult or a parent. All right, folks. Michael, I'm happy to answer any questions if any have come in. I understand EMDR is much more common treatment on the West Coast. Do you have a list of providers on the East Coast that use this treatment mechanism? I'm sorry, I don't. I wish I did. If you have a therapist, if you have a consultant, I hope that they could. But I don't have that resource. I apologize. Can you explain more about identifying with the perpetrator? What does that look like for the person who was violated? They become the abuser. Simple as that. Right? Somebody who is abused becomes abuser. They identify with the perpetrator. They solve the problem of pain and powerlessness by becoming the one that abuses other people. Simple as that. It relieves them of the anxiety of feeling out of control. It gives them a pseudo sense of empowerment. That's why people act out, who've been hurt in these ways, can act out in the most severe ways. That's what that defense looks like. Can gender identity be the dissociative symptom too? We don't think of it that way typically. But any kind of confusion can be, right? I suppose what I would say is the confusion could be the symptom, right? But if gender identity confusion exists, that could also be its own trauma, right? If I have an experience that I'm the opposite of what my assigned gender is with my sexual organs, if I'm different than that, that itself can be traumatic. So any confusion about who I am could have its basis in trauma. We don't typically think of, we've erred so much on the side of thinking that gender identity is a disorder that I'm reluctant to say yes to any degree with this, because we've believed that it was in itself always, historically, culturally, that it was a sign of mental illness. And we know now, especially with the brain research, that that's not true. So I'm reluctant to say yes, but any kind of confusion itself could be evidence of or resulting from trauma. Are there instances where the transport to evoke has become a trauma for the student? How have you dealt with reframing that? Is it possible? It's another one of those pendulum things. My answer would be yes. There are experiences where that experience is incredibly frightening. It's a betrayal of the implicit rules that the family has had. But I'll tell you, I've had just as many parents report that parent transport has been traumatic. So again, in the big picture, in the context of loving and support and a well-done transport, even if the person experiences a lot of pain, that can be healed. Oftentimes, and I've had students own up to this, oftentimes people who complain of, I've been traumatized, people that say that phrase, I've been traumatized, I'm always suspicious of that, right? Normally trauma isn't that overt, isn't that obvious. It's like when somebody says, I'm depressed. They're not really depressed. And I'm traumatized, meaning that was painful, that was hurt. The best way to respond to it, how do we deal with it, is validate it. I'm sure that was terrifying. I can't imagine what it would be like to be woken up at 4 in the morning, have your parents introduce you to a couple of strangers, and be in the Utah desert 8 hours later. Let's talk about it. So the way I would deal with it, regardless, is I would just listen, let it be, validate it, welcome it. And if it were trauma, then that would help them to move through it. If it were exaggerated or manipulative in the statement that it is trauma, then it'll go away. If I give it a place, if I don't fight it, if I don't resist it, if I don't try to talk them out of it, then it's just okay. I'm okay with it. But like I said, I've had a lot of people. One of the claims that children will have when parents start to change the rules in the family and set boundaries and develop appropriate hierarchy and boundaries and limits is they'll say they're being traumatized or betrayed. And the best way to deal with it is, okay, I believe you. Thanks for telling me. Let's talk about it. What does that feel like? My response is, what's the goal? Is the goal to make the parent feel guilty? Because that's probably not what trauma looks like. Is the goal to try to hold somebody emotionally hostage? Because that probably is not very authentic in that process. Is EMDR still effective as time passes after the abuse? Yes. I don't practice EMDR. I know of it. I know clinicians who do. I don't practice it. But yes, it is great at getting to buried, unconscious historical trauma. And it's not even like the content has to be completely known or unfolded in the process. It's like sneaking in the back of the computer and looking at the wiring. Can you recommend a book about trauma and control? The best thing I can do for you is go here. Copy this Parent Alumni Foundation page link. Go to our page and it has a section on trauma. Several books on trauma. And go there for starters. All right. All right, I'm going to run through these slides. We're having the private reading and fundraiser in New York City on the 18th. Let us know if you'd like to come. Send us an email. You can send that to webinar@drbradreedy.com. I'll be in New York that week also running a group with Gregory Koufakis. So those of you in New York, we'll get some more dates on there also. Here are the upcoming intensives on the right side of the screen. We'll get you the date for the next workshop as soon as we can. We have the Pursuits Outdoor Adventure trips. Please go to 6 of these meetings while your children are with us. No matter who they are, no matter what their issue is, please go to 6, any combination of 6 of these while your children are with us. Follow us on social media. Find out inspirational pictures, quotes, stories, and announcements. There's the book. You can get it on Barnes & Noble, Amazon, or you can get an audio version of it. And that's the if you go to that link at the bottom, not only do you have categories of books, but also you have you give 10% of your book purchase on Amazon goes to a charity to people who can't afford treatment. The next webinar will be next week on the holidays, having your child away from home, either in wilderness or in residential care somewhere over the holidays. I'll talk about the grief, the loss, how to make meaning of it, how to move through it, how to make it, give the suffering, the difficulty of it, some meaning in your life and meaning of your child's treatment life. Thank you for joining me tonight. I hope this is a helpful point of contact, and I hope that we all walk away with one insight about how to respond to trauma and symptoms of others, and how we can also become aware of our own trauma and how it can affect the way we function, the way we react to others. Have a great night, folks, and I'll talk to you next Tuesday. Take care.